they rush pikin come. Pikin no dey breathe. Hey, emergency, emergency, emergency. Madam, wetin happen to the pikin? Say, I don't know. And we just see am no dey breathe. We cannot tell her this one. Like, we won't be magician. Now, wetin you tell us, now we take the work. It dey very funny when doctors they beg patients, say, Madam, I beg talk true. If I tell you, say, patient they lie, you go believe me. Patients they lie well. And today, I did with my colleague, my friend, my co-host. Some people talk, say we look alike. So we brothers. You think say we look alike? If you feel say we look alike, put them for the comment section. And today we want to talk about the medical lies where patients they tell their doctors or even you. So make I introduce you again. You know him. See him, Dr. Israel. Say hello now. Talk to them.
Now I don't know. My name is still remain Dr. Irobon Sales Israel. I never change. So today we will tell now some things when we don't hear, when patient don't tell us, when they don't lie to us, when later we can't find that saying a lie. And thank God, sometimes some of these patients we were able to help them. Why some? We give God glory for their life.
Now, if you just come, this is not doctor's gist, not normal gist where they talk, together, many things we don't see. Now, I want to start on this note. When you lie to your doctor, you think say it is safe, it is very, very bad, and if it costs you your life. In the sense that, let's say you get headache and you go take substance, now you go high, and you don't let your doctor know, say you take some kind of things. As you won't help you, it can't give you another medicine that will help your headache. That medicine can't react with what you take because you don't tell them. What is it good to you? I die with that. So, Dr. Israel, what think be those experiences where you don't get, where patients lie? When you hear anything can shock you.
Man, many of the things, not with something, there are many. So one of the things when we know say most patients they do now when it comes to their children, most mothers they lie when it comes to their children. Like recently, like 2 days or 3 days ago, that I just the recent experience. A woman when be say pikin they get fever.
Yeah.
Come meet us say a pikin get even meet us.
Yeah.
Now person even notice say man, this pikin almost they get convulsion. So until we can't find that say this pikin body they hot. It was almost 40 degrees Celsius. Where this woman say, Alpha, this pikin they get fever. He say no. So now this morning, in the morning then it just start. So how will this fever just start in the morning and you were with us that morning and before when we talk to her, I got to say yes, he gave her paracetamol yesterday night and all that. So if this woman tell us saying give her paracetamol yesterday night, it means say that fever already did there beforehand. Well, that fever to just come give that pikin, can't even make her get convulsion. We say something don't go ground.
Go on.
Another one, they say when they talk about patients, they lie to doctors and they cause many problems. You not say with a joke. Imagine somebody get headache and not tell us say this headache don't dey there for a long time. And we just say okay, now 2 days headache. We say okay, we'll ask her some other based on how you tell us how long you don't get particular symptom. Go determine how we go ask you questions that follows. Some person tell you say you get headache for 2 days. The next thing when you want to ask now your body they hurt, then we go they think maybe this person don't get malaria. But when you tell person say you get headache for 1 month, 2 months, then we go they think something else, something different. But you see somebody will come when you know saying they get headache for like 6 months. They'll tell you say now yesterday or day before yesterday, now the headache.
I don't know why, because most times when people do that thing, maybe I don't know why we did do them, not to test the doctor, say if I tell them, say this headache don't start for 4 or 5 months, he no go feel no. So make I lie, give them. Because many causes of headache there.
Yeah.
Headache of yesterday and headache of 6 months no be the same.
Not be the same.
So when you tell your doctor, say this headache, it just started yesterday, but true, that headache don't dey since last year, you say think how you think say the doctor will help you? In that regard, it will make wrong diagnosis. 1, confirm. Number 2, the medicine we go
give you go different.
Go very different. You know go work. The next thing again, you go come suffer.
That be the thing.
The next thing again, you can't blame the doctor, say the doctor no sabi work. Whereas now you lie, give the doctor. And when doctor they follow you talk, get one question we would always ask you: when he starts.
And that when it starts, be very important because now it will help us know the following question when we will ask, and it will even help us know the kind diagnosis when we will give. Another one thing when I think say they make patient not they talk truth. One, some of them, some will not be all of them. As you talk, some want test, some feel be fear. They will be not saying they tell the doctor saying this thing don't do this for a long time. The doctor go quarrel with them.
Or maybe the money will come cost.
Either the doctor quarrel with them or the money go come cost. Why you say why the doctor say why you not come since? Why you not come hospital since? Or maybe because of that, the money will come go up. So that na one reason I think say they make them the fear, make them not the quit doctor the main thing, and follow with they want test the doctor because I know many patients they really want test doctor. They want to see whether this doctor no work or not. Imagine somebody don't go school for 7 to 8 years or so. You want to see test her. Maybe because you read one thing for Google.
Yeah.
Then you come the thing say make I not tell her this one. Will not be magician. Now, what till you tell us, now we tell they work.
I know where this thing come from. You know, some people online, when people listen to us, ask them question, you say, maybe I get headache. You go here, because of your headache, now this thing cause them. Go drink this thing. And I go to say, I get abdominal pain. The person go tell them, your abdominal pain, now your liver they cause them. Go and buy this thing and drink. So they say, Jesus. So when they come meet the real doctors now, they come ask the doctor, he can't tell you, say, you're going to go hospital, you're going to see your doctor 101. They will talk to the doctor, no one help them. Yes, so in that regard, they won't lie, just tell you sharp, make them find out what will happen. The truth is this, if you lie to your doctor, you go suffer because he will make wrong diagnosis for you. Medicine where he will give you no go work. The problem waiting for there will continue. Let's talk to somebody get swelling. Something different for the person, but the way swell up. They can't ask you when it starts. You say, no, this thing not just yesterday it starts, in the last week. And we know, say some kind of swelling, no, it just start last week. Because even the way the swelling take grow will point our mind to somewhere. If the swelling don't day for 1 year, it dey different than swelling we just start 1 month or 1 week, just grow fast like that. That is why it good make you know they lie. If you dey lie, stop am. Get one lie where one woman talk one time. The rush pikin come. Pikin know they breathe. Hey, emergency. Madam, wetin happen to the pikin? Say I no know. And we just see am no dey breathe. Madam, if they talk to me, they lie. Wetin happen? You say no, nothing happen. No. Now somebody for there can say, Madam, or you tell them if not, your pikin go die. And you say, the pikin no want chop. I can't bend the head. Can't they pour? I can't cover his nose. Can't they pour a come for his mouth? Pikin can't choke. I say talk that thing quick.
You know what to do.
We know what
immediately.
But imagine say in
no talk that one.
In no talk. As we do the thing so quickly, when they suction, when they come out all the things we enter the pikin long. Luckily, the pikin survive. So if you dey lie to your doctors, it dey very bad because doctors no be magicians. All the things we dey see online, we person go tell you say, I don't see one video. They say if you're having headache at this side of the head, press here, the headache will go. I know I don't see that video.
No,
say if you cannot sleep, press this part of your hand and do like this, you'll be able to sleep. All those short videos, no be so body they work now. No be so. I beg. This is why it's important that whenever you meet your doctor, tell them, even if the thing when you do, they're bad, confess, just talk.
If you talk, and that one are the first way to solve your problem. Another way when patients they lie to doctor now when they take something, when they take something or give person something, they no go one talk. Maybe they don't take native medicine, or they don't take drug when they not supposed to take. They no go one talk because they not saying they talk. They'll say, this doctor will quarrel with them. I remember one patient who we get for ward one day. This one don't take small. This patient, in the ward, he stay inside hospital. The patient, the relative come, they can't give a native medicine for inside there.
Inside the hospital.
Inside hospital. Now then the woman can't choke. The woman die.
Gee.
We were even trying to do resuscitation, CPR. We dey try to do CPR. Wetin they give her, now they pour coma for a nose and mouth.
Wow.
Now that time we can't even say they give her something.
So they're not talk.
They not talk. When the thing don't choke the woman, then they run, they can't call us. We dey ask, because the woman was a bit okay before we leave her. Then later they call, they run, they call us. Doctor, wait, what one I give her? What did I give her? Nobody tell us anything. Now what would they do? So okay, we could do CPR, we'll see whether the woman will come. So, wait till they come out. All of them come, they put face for one place. Now so that woman stay there.
Oh no,
because they give her waiting they're not supposed to give her, and they not even let us know. So they use this medium. You see, waiting Dr. Fred first talk. Add small picking for your take there. If like say the mama not come open up. Now so many patients don't take there because they either they themselves take something or somebody give them something, or waiting they worry that they not tell us on time and how long you don't worry them. Imagine swelling when they do person for hand or anywhere. You tell us say, now yesterday I don't big once. We don't think of cancer or something very serious. But then they can't test money when you go even spend. Go many pass. What you go spend if you really tell us the truth. So I beg, Mona help us to help una. Doctor na one set of people when you're not supposed to lie to at all.
They say get people when supposed to lie. One na who?
One na doctor,
one na
lawyer, and the other na pastor.
And pastor.
Those are the three people where you're not supposed to lie.
You can lie to anybody. If you want to lie to your boyfriend, you sabi.
Not consign me.
Not consign me. What you consign me, and don't where they do. And I beg, whenever you go see your doctor, open mouth, talk the truth. You lie, now you go suffer. Like I always talk, good life now waiting.
Na sense.
Good life na sense. We'll come back again for the next session. And if you learned anything, drop them for the comment section. Tell us what you learn. So that as they make next video, what they see in our comments. I will see you later, no go anywhere. Okay, is there any final words?
When I young remain with us, we get many things to tell una all the time for this doctor gist. And now just for una to learn more, and so that when una reach hospital, una go see if it behave well, so that the doctors go feel help una well.